Welcome to episode 14 of the free weekly Brave Journey birth preparation videos. This week I'm sharing another video that I originally recorded for another purpose. I'm just recording this introduction at a different time. And what I did is I recorded what I thought would be a lesson for my full Brave Journey birth preparation program, the paid program. And I have since decided to completely rework the way I'm introducing concepts and the way that I'm introducing and organizing materials within the full Brave Journey birth preparation curriculum, the program. So I'm going to end up re-recording all of these videos, these concepts, in order to connect the dots properly with the way I'm introducing concepts. And so this topic today is the 6 signs of progress in labor. It's about the physiology of labor. And the reason this is important is because often in the birth room, the birthing person is anxious to hear that there has been progress. The birth partner is often anxious to hear that there has been progress. And the medical care providers are having to document progress because in most medical care facilities, most hospitals, there's an expected amount of time allowed. That's a loaded word, and I'm not going to get into it here, but there's a certain amount of time that the medical care providers expect a birthing person to be at a certain stage of their labor before they want to see progress. So it's important to understand as a birthing person, it's important to understand as a birth partner and a labor support person that there's a lot more that goes into progress in labor than just cervical dilation. And so I'm going to talk about this in the video that you're about to watch. So without further ado, this is the video on the 6 signs of labor. Oh, and one note, in this video I do mention things like, in this lesson we're talking about this, and in future lessons we're going to talk about hormones of labor. And just know that it's because I originally recorded it to be in the full curriculum. I'm not using it for that. I'm offering it as a free Brave Journey weekly video. But if you hear me referencing lessons and lesson concepts, that's because it's concepts that will be offered in the full program, the full curriculum. Okay, without further ado, here it is. Progress in labor is so much more than just the cervix opening. You may have heard birth stories from friends and family, or just generally in the ether, just in the world, where people tell their birth story based on cervical dilation. And they'll say things like, and then we went to the hospital and we checked in and I was 6 centimeters dilated and blah, 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 blah. So these centimeters dilation are between 1 and 10 centimeters, but that is just one of many different methods of identifying progress in labor. There are actually 6, and I believe it's really important for birthing people to go in knowing all 6 signs of labor progress in order to understand just how, if the cervical dilation doesn't seem like it's happening as quickly as they think it should be happening, that they'll know that all these other signs of labor are happening, that you'll know that if your cervical dilation is not the number that you want it to be, you think it should be more dilated than it is, that there's all these other signs that your body and the baby's body are getting ready for birth. So the mechanics of contractions are complex. With each, if this is the uterus and this is the cervix, the uterus and the cervix, each contraction is not only pushing down. Here, we'll get a little baby doll. So this baby is in the uterus and here's the cervix. With each contraction, the baby is getting a little bit of pressure pushing on their body and pushing them down into that cervix. The cervix is the mouth of the uterus. It is all one thing, and the cervix is the mouth of the uterus. With each contraction also, not only is it pressing at the top, but the uterus, because it's all one thing, is pulling up on the cervix. So cervical softening, thinning, and dilating all happens partly because through the mechanics of the contraction, pulling up, pulling open that cervix with each contraction. So there are complex hormonal processes that are happening all throughout labor. We have an entire full lesson on the hormones of labor and the ways that they impact labor and labor progress. For the purposes of this lesson, just know that all these complex hormones are present and they're impacting the laboring person's mind, they're impacting the birthing person's body, contractions, they're impacting the strength and frequency of contractions. The hormones are also bathing the cervix and inviting softening in the cervix and opening in the cervix. So there's the mechanics, there's the physical contractions, there's the hormones. All of this complex interaction is happening during labor. So rather than just dilation as the only sign of labor progress amongst all of this complexity, there are actually 6 signs. And the 6 signs are: 1, the cervix moves forward; 2, the cervix is ripening, and we'll talk about these each; 3, the cervix is shortening and thinning; 4, the baby is descending; 5, the baby is rotating; and 6, the cervix is opening. So first, the last few weeks of pregnancy, early labor, the cervix begins to move forward. This is a sign of labor, impending labor. The cervix also ripens. So in the final weeks of pregnancy, the final days of pregnancy, all through early and active labor, the cervix begins to soften. So during pregnancy, the cervix, if you were to touch it, would feel more like the tip of your nose. By the time labor is active and rocking and rolling, the cervix will be softened. Ripened is the medical word that I'll often use in the hospitals. And if you stick your finger in the inside of your cheek, that's what it feels like. So if you feel in there compared to the tip of your nose, this is happening through the final weeks, hours, days of pregnancy. The change of the cervix from like the tip of the nose to the cheek. So if it's softening, it's ripening, that is a sign of progress in labor. Cervix shortening and thinning is called effacement. When cervical checks take place in medical care facilities, hospitals, birth centers, home births, the midwife or doctor or nurse will give an effacement assessment. It's a percentage. Usually they'll say like 20% effaced, 75% effaced, 100% effaced. The cervix through pregnancy is thick and long, and it begins to slowly soften. It gets super ripe and squishy like the inside of your cheek, and then it thins to the point where it's as thin as the rest of the uterus. And then the thinning, the effacement, allows for dilation. So the cervix opening and dilating 1 centimeter to 10 centimeters is the final sign of, not the final, it is another additional sign of progress and labor. There's often the most emphasis placed on cervical dilation, but all of this is happening. In addition, the baby is descending and the baby is rotating, the other 2 signs of progress and labor. So there's a whole other, in addition to the birthing person's body, there's a whole nother human being that is going through the birthing process, and that's the infant. So station is how high is the baby in the pelvis. So the progress and labor will be the baby descending into, well, let's get the baby in optimal position here. The baby is descending into the pelvis down to where they begin to emerge from the vagina. The baby is also rotating. So the baby has to go through a whole sequence of movements. They're called the cardinal movements. Imagine this is the baby's head and this is the baby moving through the vaginal canal. The baby has to make this path all the way out to being born. And this twisting, turning process is so complex. It's such a long few inches. And so if you can think of that when you're in labor, staying upright and moving, it can help to think of moving with the baby and inviting that baby to find those important rotations as they move their way out. So those are the 6 signs of progress in labor. Okay, that concludes the video for this week, episode 14. And next week, I'm going to take another chunk from what was going to be part of the full curriculum that I'm no longer going to use these videos. And the next chunk I will be talking about for the next weekly video will be prodromal labor, which is sometimes it's considered part of early labor, but it's a discussion on the stages and phases of labor. So over the next few weeks, we'll go through prodromal labor, early labor, active labor, and transition, pushing, etc. So thank you so much for watching. Thank you for your support. Please comment and let me know what you're thinking. Send me an email, kara@bravejourney.com. The conversations with pregnant and expecting people always bring me great joy. So please reach out. I'd love to hear from you. Thank you for watching, and I'll see you next week.